Hi, my name's David Fulcher. I just wanted to give you a quick rundown on this year's course in clinical immunobiology. You may have heard about the course, hopefully you have through word of mouth or through your DPT. This is what it's all about in detail. So the course started off with a face-to-face lecture series over a weekend. COVID put an end to all that, so we have retained the roundabout 30 lecture format, but of course it's now all online. I've introduced the term clinical immunobiology, and I don't want that to cause any confusion, but that's basically what the course is all about. So it aims to combine clinical immunology, the diagnosis and management of patients with immunological diseases, in the context of the immunobiology, namely the basic science of the immune system. So it aims to teach the basic science, those fundamental building blocks of our immune responses, and then make that interesting to doctors by illustrating how that biology is useful for understanding immunological disease and treatments that are based on this immunobiology. The focus is on immunodeficiencies and allergies, particularly, which lend themselves very nicely to the biology of the immune system. So we talk about immunopathogenesis, all the fundamental aspects of the science of the immune system, but geared towards doctors, particularly those interested in internal medicine. So, for example, a fairly standard textbook description of complement. I sort of compact that down to just to the essentials of what you need to know. But soon after teaching that, we go on to talk about the implications for managing and diagnosing and identifying patients with diseases relevant to the complement pathway. I teach you all about the structures of the immunoglobulins, but in the next lecture, we immediately illustrate that by showing you why you need to know about the different types here, for example, of IgG in this important condition, the IgG4 related disease. And what happens when it goes the other way and IgG is missing, and how does IgG deficiency present itself in the form of common variable immunodeficiency. So I know the way people learn. I learn by understanding and seeing the graphical depiction of these aspects of the immunobiology. So lots of graphics, most of which I've drawn myself, to illustrate all the aspects of the biology that we go through. So at the end of each lecture, I try to make them short and sharp, like about 30 minutes, sometimes a little bit more, sometimes a little bit less. And then at the end of that, we go through 3 revision questions to make sure you've got a handle on the essential aspects of that particular lecture. So that gives a little consolidation phase to that particular lecture immediately after it's presented. And at the end of the course, we go through this graphic, Immunology in a Page. So it's about a 45-minute lecture where we revise all the basic biology in a nutshell as we work our way through this fairly complex but readily understood document. And right after that, just to make sure that you've got it, we do an MCQ trial exam of 50 immunological MCQs, and then I work through the answers to those questions immediately afterwards. Now, there are extra lectures outside of this sort of clinical immunobiology for which I've asked some of my colleagues to assist with. So Dr. Mingwei Lin will talk about vasculitis, Dr. Dunkley is an expert on transplantation, and Teresa Cole is an expert in pediatric immunodeficiency disorders. So for the pediatricians who do the course, this lecture is highly valuable. Now, how does it work? As I mentioned, since COVID, we've gone online, so this is a video-on-demand course. Basically, you sign up whenever you like. You can rent the whole lecture series and you'll have 30 days to work your way through. Sort of one lecture a day for a month, but of course it's not designed to do that. It's designed to be sort of packed into a smaller space of time, but do whatever you like, whatever works for you. You can stop, you can pause, you can replay, you can look at a lecture twice, whatever you like. You have that 30 days to work through. Obviously, I can't be online continuously, but any questions arising, just email me and I'm happy to try to address those. Previously, we've sent out manuals. This is getting far too complicated, and things have been made a lot easier this year by the imminent release of the Primer of Clinical Immunobiology, which is the textbook, not really a textbook, it's more a novel of the course, which I've put together. Well, the course has been worked on for the last 20 years. This is the 20th anniversary this year. And to celebrate that, we have the release of this ebook, which will cover everything in the course, all the graphics, all the explanations, a few asides, a few illustrative material, a few cases. It's designed to be really easy to read and very accessible. So each chapter of this book corresponds to a lecture in the course. So you can follow along the lecture in the textbook and underline and highlight and come back to it as often as you like. This will hopefully be available by Apple Books and Kindle. Apple Books will be a bit cheaper because they don't have a charge as big a cut, but hopefully both platforms will be there for you to download. Okay, so who's the course for? Anyone who needs to know about clinical immunology and immunobiology. So it's been designed specifically for basic physician trainees because we cover the basic sciences and the clinical applications. It's also very relevant to pediatric trainees. The immunobiology is very similar, of course, between adults and kids, and we have the dedicated pediatric immunodeficiency lecture. There's also references to pediatrics right through the course, so we've got you covered. But if you're in another specialty where you have to know something about immunology, this will work for you. If you're an established physician and you just want to get an update, this is fine. You will benefit greatly from this course. Just as an example, this year's exam, look at these topics that came up in the 2025 paper and see how much you would know about them. And I've just thrown up on the right the slides which are immediately applicable to virtually everything, well, actually everything that was asked in this exam. So if you don't know about these topics now, this course is absolutely going to get you up to speed before the big day. Okay, so that's the course. Basically, there's so much that I could include in the course, and I'd like to include in the course, but it will just sink under its own weight. So the spillover exercises that I'd like to put into the proper course, I've put into a Patreon teaching site called Immunology for Physicians. And every week I try to write and record another teaching session that adds on value to what's in the course proper. So these are mini lectures, revision lectures, MCQs, anything interesting that comes up in the news or the New England Journal or other magazines, throw them all in there for a quick 10-minute grab of immunology. Before the exam, I tend to increase the intensity of MCQs just to get you revising and giving you confidence in what's going to come up. But now, I've been doing this for over a year now, there's a whole resource of learning exercises there that you can unlock for a very small amount per month, and all of that goes to the World Wildlife Foundation. So, I don't make anything out of this, but it's a nice exercise to reinforce your learning and to support improvement of platypus environment, I guess. So everything you need to know, I try to keep this website updated. I'll probably do that right now. So look on there and we'll keep for all the latest information. It does change occasionally as we get closer to the big day. Okay, now when you go onto Vimeo, and the link I will come to very shortly, you'll find actually two links. This is hopefully not confusing. The standard Immunology for BPTs course will be there, clearly marked, and you get all the core lectures plus the 3 extra lectures that I mentioned, as well as the MCQ exam. Immunology for Physicians is an alternate cut-down course which just has the core lectures, and that's mostly to service people outside Australia who buy the book and would like to do the lecture series to complement the book. So you can do a cut-down version if you don't want these extra lectures or extra activities, but basically I would recommend for Australian trainees to head towards this website. All right, so that's all I've got to say. These are all the learning activities that I run, just to summarise them and give you the links that you can use to take it further, which are all on the website, of course. So the website, the Patreon teaching exercises, the Vimeo streaming lectures, and soon to come the Primer of Clinical Immunobiology, which will be a rich textbook for your learning. I often get asked which textbook I'd recommend. There really is nothing out there that is dedicated to internal medicine trainees in immunology. So hopefully this will fill the gap and provide something to consolidate your learning. Okay, well, I hope you find that useful and can join the course. All the information is here. Email me if there's anything else you require. See you a bit later.